segment is nursing in the USA, and I am joined by one of my colleagues. He's actually a nurse here, and he works on our clinical team at Healthcare Cell International. His name is Ryan Kiefer. Ryan, do you want to introduce yourself? I know you have a fun topic to go over today.
No, absolutely. Thank you, Erica. And happy Thanksgiving, everybody. Definitely an exciting time of the year here in the U.S. as everybody gets together, spends time with their significant others, loved ones, or just takes time to relax and be thankful for everything that they have. And so looks like my battery's running low because I've been sitting here for a sec. But just to kick things off here, wanted to touch base and talk about some of the clinical aspects of working in the United States and how we can, help to support everybody as they embark on their transition of their nursing practice to the U.S. And so, really what we wanted to focus in on today is the assessment aspect of nursing, right? So your patient assessment skills and how important those are and how impactful they are to positive patient care outcomes. And so the assessment, as you know, with the nursing process is the first step, and the rest of the nursing process doesn't happen unless you have that assessment completed at first. And so, with that comes the skills and knowledge and practice you need to be able to perform an accurate patient assessment. It's really important, and we focus in a lot on preparing our nurses for the assessment aspect of their skills when they get to the U.S. because it's responsible for collecting that real-time data and applying the nurse's critical thinking skills. So not only do the clinical skills you use come into play, assessing the patient, but also your critical thinking skills, understanding what it is that you are assessing, so then you can put into place the right diagnosis, planning, implementation, and then follow-up evaluation further on in that patient's care. And so as you gather that data, the stage can be, significantly impact the patient's health outcomes. So aside from evaluating the exact condition that prompted that patient to seek medical care, throughout the assessment, you're also looking and possibly identifying other aspects and care needs that patient has that they may not have presented with originally. And so they, finally, kind of just sum that up, right? So the nurse's role in the United States is to be an advocate for their patient. That not only is, speaking on behalf of the patient for the concerns that they have, educating them and providing them and their families education on the care that they're receiving, and looking out for their best interests, but also, understanding what it is that you're seeing in the patient. Recognizing the changes in care that they need and communicating these effectively to the physicians and the rest of the care team, which could include respiratory therapists, medical technicians, speech therapists, occupational therapists along the way. The nurse is advocating those things too and communicating those to those professionals to continue to progress and advance the patient care. And so some of the equipment that you might encounter that is definitely good to review and be familiar with as you start your career here in the United States would include things like a stethoscope, really understanding the functions and purpose of a stethoscope, pen lights for your neuro checks, manual blood pressure cuffs, automated blood pressure cuffs, automated vital sign machines where you can then obtain pulse oximetry, patient temperatures, thermometer probes, rectally. And then the big one is, charting, right? So part of your assessment, right, is then documenting everything that you've assessed and gathered for that patient's care. And so without any documentation, nobody really can share that information across the care team, which again makes up your nurses, physicians, and therapists. And so understanding the documentation best practices is extremely important. So whether that's electronic medical records, good old-fashioned pen and paper documentation and charting, it's important to really know that is a large time-consuming portion of what nurses do, aside from the direct patient care, but also ensuring that all of their assessment data that they've been collecting through a 12, 10-hour shift is being accurately documented so that the physicians and all the other professionals can then go in and see, track and trend, and ensure that the patient care that's being delivered is being prescribed effectively. And then finally, a huge part of the assessment process is the interpretation of different values, whether it's laboratory values, so being aware and focused in on what the normal lab values could be for patients' blood work, urinalysis, um, ABGs, the different lab values that are collected, but then also EKGs and imaging reports, really being familiar with the vocabulary and rate and rhythm interpretation if that's something that is in your specialty of nursing, whether that's telemetry nursing, step down, critical care or emergency. Understanding those values is extremely important as well. And then finally, your protective equipment, right? So understanding your use of the PPE and ensuring that while you're assessing the patient and providing your care, that you are doing it safely and in accordance to whatever PPE is required for that patient. And so it's never too early to really start preparing for your journey to the U.S., undertaking a lot of the roles and responsibilities that U.S. nurses take on and sort of bear the weight of in their practice every day. And so through that, Health Carousel has developed our transition to practice curriculum. So all of the online available coursework that gets assigned to you prior to your arrival includes courses and trainings that are designed to focus in on not only assessment, but other important nursing skills and practice to help familiarize you with the U.S. healthcare environment. And so we always strongly encourage to take advantage of that online learning management system, but not only through the assigned curriculum and your to-do items, but when that gets assigned to you, you also have access to the entire library of course and content through that online learning management system. And so there's over 10,000 courses focused in on nursing and healthcare skills and practices to help you familiarize yourself with the U.S. healthcare environment. And so we really encourage taking advantage of that. It's a great place to gain CE credits for licensure and licensure renewal here in the United States, but also just good refreshers with the best practice updates of any of the skills that you need that are applicable to your nursing profession and the specialty where you operate. But not only that, you always have myself and our other internal clinical team here. We are your clinical support members, your advocates, your career coaches. And so if you ever have any questions, as you prepare to make your journey here to the US with any of the trainings that you're completing, any of the information that you're reviewing, or even once you arrive, certainly you can reach out to your advocate, your IES, your IDA, whoever it is that you are working with Health Carousel, and just say, hey, I would love to speak to your clinical team. I have some questions related to my online trainings or just some clinical questions that I would love to review. And we can certainly jump on a call to see how we can continue to support your journey because, I've worked here at Health Carousel for over 6 years now. And so I have focused a lot of that time supporting our international nurse that we have here. And so I love the journey that everybody just embarks on and coming to the United States. And, I know it's a lot and I can't even imagine, kind of going through that myself. And so we want to be a support to you and make sure that at least the clinical transition of your practice goes as smooth as possible. So happy Thanksgiving to everybody. If you have any questions, don't hesitate to reach out. I look forward to being here to support you through your entire journey.
Thanks, Ryan. And yes, like Ryan said, I just want to add on to that because from a recruitment perspective, I'm our director of recruitment and programs. Some of the biggest questions we get when we're first starting to talk to a nurse about their journey and coming to the United States is like, how will you support me once I'm in the United States? Like, there's a lot of training. What's the training like? What's the orientation like? And, what happens if I fail? What happens if I'm not successful? And you guys are there I know sometimes it's thankless, but you guys are there to support our nurses nurses, and you guys have calls with them every single day. So ones that are on assignment that may be struggling to integrate or struggling with some transition to practice or need some additional support or resources, you guys are putting in the work to support them. And we're so thankful for you guys. And so everyone on the call, you can know that you're going to have Ryan on your side or someone from his team that's going to be there if you are having any issues. And like he said, you can reach out to us anytime. So thank you for joining us today, Ryan.
Oh, it's my pleasure. Thank you, Erica.